35 years ago, George D. Winter had already established that it is necessary to combat hypoxia for effective wound healing. Recent publications have also come to the same conclusion. Hypoxia prevents the healing of chronic wounds. So what is hypoxia and why does it impede wound healing? Michael Zander, Managing Director of Granulox's manufacturer, Sastomed. Hypoxia simply means a lack of oxygen. In terms of wounds, this means there is too little oxygen present at the wound base to maintain all the normal metabolic processes required for healing. Imagine that the wound is a major construction site. There's a lot going on, and this activity requires energy. The body produces this energy by burning substances with oxygen. In other words, it's as if you were running the 100 meters but were only allowed to breathe through a straw. You'd run out of breath pretty quickly. A similar process occurs in the wound. In normal tissue, the concentration of oxygen, measured as the oxygen particle pressure, is sufficient. The oxygen particle pressure is over 40 millimeters of mercury. For most chronic wounds, however, the oxygen concentration has entered a critical zone, making wound healing next to impossible. In most cases, when the concentration dips below 20 millimeters of mercury, the tissue starts to necrotize. So why does no oxygen enter the wound? There are many reasons for this. However, it is possible to say that microcirculation disorders, or disorders of the surrounding blood vessels, are the key reason why too little blood, and therefore too little oxygen, reaches the wound area. This primarily relates to three major symptoms: venous insufficiency, peripheral artery occlusive disease, and diabetes mellitus. So, too little oxygen accesses the wound from inside the body, but no oxygen can reach the wound from the outside either. The reason for this is that wounds are covered with a thin film of fluid known as exudate, which plays a key role in the healing process. However, oxygen cannot permeate this layer of fluid, rather like a swimmer just under the surface of the water who cannot breathe on his own without a snorkel. In short, the primary disease prevents the supply of oxygen from within the body. The wound exudate prevents the supply of oxygen from the outside. This hypoxia impedes important healing processes and the wound cannot heal. As we've seen, the wound exudate acts almost as a complete barrier to oxygen. What we require, therefore, is a way to get oxygen to permeate the wound exudate. Sastomed Managing Director Michael Zander explains how Granulox does this. If we imagine this glass of water as a wound, the oxygen required is in the air above the water. Below you have the wound base, which is where the healing is meant to take place. But the cells are dying off because they have too little oxygen. The water represents the wound exudate, through which the oxygen cannot penetrate, so we need a kind of transporter, Granulox. All you have to do is spray it on the wound, just for a few seconds. And as you can see, the red colour from above is distributed evenly through the wound exudate. The red is hemoglobin, the molecule that transports oxygen through the body. The places that are red represent all the places where oxygen can be transported. This means we've managed to cross the barrier, enabling us to transport oxygen from outside to within the wound at a rate of up to 1 litre per day per gram of hemoglobin. Granulox spray consists of natural, exceptionally pure hemoglobin. Once it's been sprayed on the disinfected, irrigated wound, the hemoglobin starts transporting a steady supply of oxygen to the wound base for up to 72 hours in one stretch. It's a simple but brilliant approach with an incredible effect. We've now treated several thousand patients with Granulox. It's truly incredible to see that wounds that refuse to heal, sometimes for decades, now start to heal. It's clear that the wounds now have the oxygen they need to heal that was previously not available to them. In addition, we've also seen wounds that showed delayed healing closing much quicker. In general, the patient suffers less from their wound symptoms. The risk of amputation is decreased, and the patient can regain his or her quality of life more quickly. In short, hemoglobin is a natural supplier of oxygen. Granulox is a hemoglobin spray. Once it's applied, it supplies oxygen to the wound base for up to 72 hours. Hypoxia is resolved and wound healing accelerates. The efficacy of Granulox was proven in a study conducted with the Charles University of Prague, making it an exception in the field of wound preparations. The study was conducted in 2 groups of 36 patients each, all with ulcus cruris. Prior to the start of the study, none of the patients' wounds were healing using standard treatments. One group continued to receive the standard treatment, while the other group also received Granulox spray. The duration of the study was 13 weeks. Principal investigator Professor Dr. Arenberger from the Charles University of Prague presented the results at the Interdisciplinary Wound Care Congress. Here you can see the results. It's clear to see how the wound size reduces during treatment. The positive effect of Granulox on healing became clear in the analysis. Within 13 weeks, wound size was reduced by an average of 53%. Wound size in the placebo group remained practically unchanged. The same results were achieved regardless of the wound size. Wound pain also decreased progressively. Professor Dr. Arenberger's summary. In short, it is possible to say that the wounds continue to heal regardless of the wound size. Granulox is therefore simple, effective, and has no undesirable side effects. How has Granulox stood up to practical use? Nesat Mustafi, head of outpatient wound care at the Krankenhaus Nordwest Hospital, reports of his experiences. Sastomed originally stated that results would be noticeable after 4 to 6 weeks of continuous use. But it came as a pleasant surprise that some wounds showed significant improvement after just 10 days. I now use Granulox on all wounds. I've now treated 260 very different cases and achieved excellent results all round. Let's take a closer look at these cases. The wound was quite large and malodorous. There were several open wounds on the lower leg. The patient told me that she had been receiving treatment for almost 3 years and had been treated with various dressings. On the 3rd of January, we started a continuous therapy applying Granulox and silicone foam 3 times a week. From that point on, it was clear to see that the wounds became smaller from week to week. 2.5 weeks ago, the wound on the outside of the lower leg was finally closed. Three further case studies from Nesat Mustafi's experience clearly show the efficacy of Granulox. In this case too, it's possible to see that each time the dressing was changed, the wound base looked much cleaner. These are the results with Granulox after just under 4 weeks. Prior to this, the patient received treatment for 7 to 8 weeks. In this example, the wound was disinfected in an outpatient setting on the first day only. Then Granulox was applied by the patient for 6 weeks. In addition to the clear healing benefits, something else was particularly noteworthy for Nesat Mustafi. In several patients, I observed that new skin forming above the wound looked similar to normal skin. I don't know whether that was just my personal perception, But other colleagues who have used granulox have also reported similar results.
Granulox verwendet haben, konnten mir von ähnliche Ergebnisse berichten.
This is why he also uses granulox on acute wounds.
Bei Menschen, die keine
For
Probleme
people who do not have any problems or concomitant disease, the body needs 21 days to close a wound.
haben, eine Wunde zu verschließen.
However, if I use granulox on acute wounds, I can get them to close in 10 to 12 days.
Also ich glaube,
This contradicts all natural wound healing times.
zu schätzen.
I think that colleagues who use granulox really appreciate its benefits. I advise colleagues who've not yet used it to try it out for themselves to find out more, but over a period of several weeks in order to achieve results. Theory is all very well, but for me, practice is the best proof. My studies show what I've achieved in my patients. I completely support these results and will continue to treat wounds as has been proven effective by my experience. After all, if it heals, it heals.
In Deutschland.
In short, granulox significantly accelerates wound healing and leads to faster, better results. Granulox can be used on almost all wounds, so don't wait until a wound becomes chronic. You can use granulox at all stages. Chronic wounds not only lead to a reduction in quality of life for the patient, they also result in exorbitant costs, as investigated by healthcare economist Professor Wilfried von Eif from the University of Münster. First of all, we established the costs that health insurers have to pay as a result of incorrect wound care. In Germany, this figure amounts to around 6 billion euros per year. This means that every wound, every patient suffering from chronic wounds, costs the health insurer around 5,000 euros per year.
Der kostet die Krankenkasse ca. 5.000 Euro pro Jahr.
What can granulox do to help reduce these costs? Professor von Eif compared 3 different therapies. What is incredible is that the granulox combination therapy has proven beyond doubt to be more effective than any other therapy. The first setting is the dry setting. The second is the hydroactive setting. And the third is granulox combination therapy. These 3 settings already vary widely with regard to the amount of time required until wound closure. In the first setting, it takes an average of 301 days. In the case of hydroactive therapy, it takes an average of 90 to 91 days, while granulox combination therapy takes around 60 days. This represents a huge advantage for the patient and is also associated with major advantages in terms of costs as a result of the difference in treatment duration. One case study illustrates the cost savings that are possible thanks to granulox. This patient was treated without success for around 74 weeks before receiving granulox. 74 weeks. If you look at these 74 weeks from a cost point of view, taking into account the dressings used, the staffing costs from the wound care manager, this results in a figure of around 3,500 euros. With granulox, the treatment duration was reduced to 4 weeks, with dressings changed 3 times a week. This results in total costs of around 100 euros. In this case, it was precisely 102 euros. When you compare 102 euros with over 3,000 euros, the advantages are obvious. This means, from a financial point of view, this therapy approach is superior to all other alternative treatments. Another advantage of granulox is its ease of use, as confirmed by Nesat Mustafi, head of outpatient wound care at the Krankenhaus Nordwest Hospital. Granulox is very easy to use. Wound care remains the same as ever, i.e. with modern or wet wound care. The old dressing is removed from the wound is cleaned. Granulox is then sprayed briefly onto the open wound and a new dressing is applied.
Granulox wird danach kurz auf die offenen Stellen gesprüht und danach neuer Verband appliziert.
Once again, in more detail, Clean and irrigate the wound as you normally would. Spray granulox from a distance of 5 to 10 centimeters so that the wound is completely covered with a thin film. For a wound area of 2 by 3 centimeters, spraying for 1 to 2 seconds should be sufficient. Cover the wound with a breathable dressing. Only breathable dressings enable the oxygen to permeate the wound base through the hemoglobin. Use hydropolymer dressings, foam dressings, non-adherent contact layers, superabsorbers or hydrofibers. Hydrogels, film dressings and alginate can also be used, but are perhaps not quite as well suited. Hydrocolloid dressings, occlusive film dressings and vac systems are not suitable. Please note that if the wound has been disinfected with octenadine solution, this may limit the efficacy of granulox. The straightforward application also offers the patient other advantages. This is a product that patients can use themselves. One patient I treated used granulox herself for 3.5 weeks. The wound also reduced in size after her applying the treatment herself. Please remember that granulox aids healing but cannot replace causal therapy. There are no incorrect patients. Patients for whom the cause of the wound healing disorder has not been determined will probably not respond to granulox. If the cause has not been treated, it will be difficult to achieve results with granulox. Ideally, granulox should be applied every day. However, its application can be adapted to the regularity of dressing changes and can be done every 2 to 3 days, depending on the wound phase.